Welcome back to Questions from Quarantine. I'm Tara Tyrell, and I'm here with Dr. Margaret Bourdeaux and Professor Juliette Kayyem of the Harvard Kennedy School. Our question this week is about states reopening and the uptick of cases. I'm sure you're all aware that there has been an uptick of multiple states seeing higher levels of cases, especially as testing is getting better, of course, but also as we are reopening post-Memorial Day. I wanted to go first to Dr. Bourdeaux to see what she had to say about if this is a surprise, what she's expecting to see over the next couple of months, and then we'll move on to Professor Kayyem in terms of the logistics of all of this. Dr. Bourdeaux?
Well, is it a surprise? I would say it is. Surprises no one. I don't think anybody is saying they're surprised. I think that how I would describe the current moment is we are having a very profound lesson across the country of what public health is and what a public health system looks like when it is functioning well, robustly, and properly. And I think that, one of the things I've learned, right, is that we've spent hundreds of millions of dollars less on our public health system in 2019 than we even did in 2002. So, we're really starting from a hole, and a lot of that sort of knowledge of what it should look like and what it should be able to accomplish is not there. And one of the indicators of that is states using hospitalizations and ICU beds as their indicator whether they should open up. They've missed the middle part. The middle part is the public health system. By the time you have folks in the hospital and in ICU beds, it's too late. You already are having pretty significant community spread that you're only now seeing because folks are in the hospital. And so really what they need to be looking at is, okay, what are the capabilities of our public health system? And that means how many missing cases do they have? How many cases versus those they're identifying? How many contact tracers have they hired? How many contacts are they able to trace? Are they supporting people in quarantine and isolation? And so, until those things are in place, we're just going to be at the mercy of this virus to a certain extent. Now, that being said, I do think that the social distancing measures, the mask wearing, the hand washing, the social distancing, those are also really, really critical to have in place. But it's an and, not a either or. We need both of those approaches.
And Juliette, I know you've been heavily involved in helping at least a few states figure out their reopening plans. What are your perspectives on this uptick?
I couldn't agree more with Margaret that none of them are doing it in the way that is ideal. I mean, there was like an unspoken social contract when we were inside, which was we'll go inside, we'll shut everything down, we'll take the hit, we'll live this way, the economy will live this way, because government, you are going to do X, Y, and Z. And X, Y, and Z didn't happen. The political / it's not even political, just sort of the real, some sort of realism too comes into play. Some states actually do a good job, and we start to open up. And so I often live in the world of not ideal. So you sort of then take it, okay, now I'm handed this horrible deck of cards. And when, major retailers call me or state houses or mayor's offices and sort of, how do I deal with this hand? So then what are your different priorities? And it's exactly what Margaret was saying. You don't give up on government's responsibility, even though we may have to for some period of time, but you try to minimize risk. So we're in the risk minimization phase right now. And a huge part of that, so basically, if you thought about this as sort of a, I teach at a school of public policy, sort of like as a policy proposal, we've moved from government do this to people, you must do this. And that is what is, the president is about to have a rally in a state that's seen an uptick, in a facility that has not had an event and was not planning on having an event until September. And it's that kind of thing where, you just sort of see this hurricane forming, and it's just going to be a very, very bad thing. But between being outdoors, trying to minimize the number of people you're in contact with, minimizing the kind of interactions you have. I'm not going to a gym. I mean, and I wouldn't go to a spin class, like probably, because that kind of contact is, we know scientifically is bad. And then you keep doing your own personal mitigation efforts, and maybe all of those things together, right? Being outside, staying at home, working from home, masking when you go out, all those can get us further than we had hoped for, given the negligence by the government.
Perfect. Well, I think we'll skip the sanity and sanitation segment for this episode, since this whole episode was a little bit about sanity and sanitation. Thank you so much for seeing us this week. And as always, you can hashtag questions from quarantine for your chance to be answered next week. Thank you.